Breast cancer versus tuberculosis. A comparative analysis of morbidity and mortality. Historical perspective. Breast cancer. The history of breast cancer can be traced back to ancient Egyptian texts from at least 1600 BC that describe the disease. Radical mastectomy was the main treatment option for many years. Hormonal therapies like tamoxifen gained prominence in the 1970s, and more conservative surgeries also became available. The late 20th and early 21st centuries saw the advent of targeted therapies and immunotherapies, which have significantly improved patient outcomes. Tuberculosis. Evidence of tuberculosis has been found in Egyptian mummies dating back to 2400 BC. Known as consumption, during its peak in the 18th and 19th centuries in Europe and North America, tuberculosis was a leading cause of death. The development of the BCG vaccine in the 1920s was a major milestone, followed by the discovery of antibiotics like streptomycin in the 1940s that revolutionized treatment. Keep watching to the end to see which disease causes more morbidity and mortality each year on planet Earth. Statistics. Breast cancer contributed to 2.26 million new cases in 2020 with a global death toll of approximately 685,000 annually. In contrast, tuberculosis resulted in an estimated 10 million new cases in 2020, leading to around 1.5 million deaths worldwide. Severity. Breast cancer generally offers a more favorable prognosis, with a 5-year survival rate close to 90%. For tuberculosis, when properly treated, the majority of TB cases are curable. However, untreated TB has a high mortality rate. Treatment. Breast cancer. Treatment involves a multimodal approach including surgery, chemotherapy, radiation, hormone therapy, and targeted treatments. Tuberculosis. Standard treatment involves a course of multiple antibiotics over a period of 6 to 9 months. Diagnosis. Breast cancer. Initial detection commonly through mammography, confirmed by biopsy. Additional staging may involve MRI and ultrasound. Tuberculosis. Diagnosis primarily through skin tests, chest X-rays, and bacteriological tests such as sputum smear microscopy. Risk factors. Breast cancer. Risk factors include age, genetic mutations like BRCA1/2, family history, lifestyle choices, and hormonal imbalances. Tuberculosis. Key risk factors encompass close contact with infected individuals, a weakened immune system, malnutrition, and residing or working in high-risk areas. Morbidity and mortality. If breast cancer and tuberculosis were to be likened to natural disasters, breast cancer could be compared to a slow-moving hurricane. It comes with warning signs, and although severe, modern advancements provide multiple avenues for precaution, early detection, and treatment, resulting in varying outcomes. Tuberculosis, on the other hand, could be likened to a wildfire. It can be unexpectedly fast-spreading and devastating in communities that lack immediate access to healthcare, especially in developing countries where the mortality rate remains high. In essence, breast cancer usually allows more time for intervention, thanks to medical advancements, while TB can be swiftly fatal in resource-poor settings. Summary. Breast cancer is more prevalent in developed countries and has a generally better prognosis due to advanced treatment options. Tuberculosis is more common in developing countries and can be deadly if not treated promptly. Despite the higher number of cases for tuberculosis, breast cancer has a more advanced and varied range of treatments, making it generally better managed in healthcare settings. Tuberculosis remains a significant public health issue due to its contagious nature and the severity of untreated cases. For further reading on breast cancer, you can visit breastcancer.org. For comprehensive information on tuberculosis, refer to the World Health Organization.